Hello guys, this is Vamshi Krishna. Welcome to my YouTube channel. Today we will see some of the basic important questions for upcoming staff nurse examinations in Telangana. So the first question is, what is the most serious complication of meningitis in children? Options are epilepsy, blindness, peripheral circulatory collapse, and communicating hydrocephalus. The right one is the peripheral circulatory collapse. So the most complication of meningitis in the children is circulatory peripheral circulatory collapse. The next one is the most common symptoms of tetralogy of Fallot. So the tetralogy of Fallot is a type of congenital heart disorder. So in this type, the the defects are pulmonary stenosis, right ventricle hypertrophy, and overriding of aorta, ventricular septal defect. So the which one is the most common symptom? Options: vomiting, tachycardia, dyspnea, and fever. The right one is dyspnea. So, breathing difficulty may have the children with the tetralogy of Fallot because of having a lot of defects in the heart. The next one is when abdomen of hypertrophic pyloric stenosis. In infant, the nurse should find. So, in infant, when having hypertrophic pyloric stenosis, as a nurse, what you should find out. Options are distended colon, marked red tenderness around the abdomen, palpation of mass at right upper quadrant, and rhythmic peristaltic movement. The right one is palpation of mass at right upper quadrant. Because of having stenosis, they may have in the site of upper quadrant region, the mass can be found out because of having hypertrophic stenosis, pyloric stenosis. The next one is percentage of polio infection which are asymptomatic. Asymptomatic is nothing but the symptoms cannot be coming out. Options are 1%, 2%, 90%, 22%. The right one is 90%. So 90% of the polio infections are asymptomatic. The next one is Sprengel shoulder is due to deformity of. Options are scapula, clavicle, femur, and radius. The right one is scapula. So here you can see the children having the Sprengel disease, that is deformity of the scapula. So here you can find the grades. Okay, grade 0, 1, 2, 3, and 4. The next one is ossification of bone start at. So in the mother womb, the fetus uh, the fetus ossification of bone start in the week of. Options are 3 weeks, 5 weeks, 3 months, and 5 months. The right one is 5 weeks. So at the time of 5 weeks of gestation, the baby ossification of bone will start. So the next one is a child can copy a circle. So in the growth and development of a baby, the child, when he will copy a circle. Options 2 years, 3 years, 4 years, and 1.5 years. The right one is 3 years. So in the age of 3 years, the baby can copy a circle. The next one is all are advising eat an egg because of it consists of highest options: proteins, carbohydrates, fat, and vitamins. Because proteins, so the egg having the high rich in proteins, so all are advising to eat egg every day. The next one is when a child continuously vomiting, the nurse is to assist for which complication? Options: acidosis, alkalosis, hypokalemia, hypernatremia. The right one is alkalosis. Because continuously vomiting, the child can lose the HCl in the stomach, so it leads to the alkalosis. The next one is the longest part of fallopian tube. Options: infundibulum, ampulla, interstitial, and isthmus. The right one is ampulla. So here you can see in the picture the fallopian tube and parts. So the first one is interstitial space, interstitial portion, and isthmus, ampulla, and infundibulum and fimbriae. So if you find the distance from the infundibulum and ampulla, the longest part is the from infundibulum to isthmus, the longest part is the ampulla. So this is the common site for fertilization and tubectomy. The next one is inflammation of uterus is called. Options of oophorytis, parametritis, salpingitis, endometritis. The right one is endometritis. So endometritis is nothing but infection to the uterus muscle. How many vertebra fuses to form a sacrum? So sacrum is the last part of the vertebral column. So how many bones is to form a sacrum? Options: 2 bones, 4 bones, 5 bones, and 3 bones. The right one is 5 bones. So in the picture you can see the 5 bones over here. 1, 2, 3, 4, and 5. So the sacrum made with the 5 bones. The next one is the acidic medium of vaginal canal is due to. Options: melanoisis, Dodderlian bacilli, and trichomoniasis and gonorrhea. The right one is Dodderlian bacilli. Due to the presence of this bacilli, the vaginal canal is acidic medium. The next one is the normal length of cervix: 3.5 centimeters, 4.5 centimeters, 2.5 centimeters, none of the above. The right distance is 2.5 centimeters of cervix. Endometrium will transform as during pregnancy. So, from normal to during pregnancy, the endometrium is transformed into options: trophoblast, placenta, gravida, endometrium, and decidua. The right one is decidua. So, in non-pregnant women, the uterus is endometrium, and during the pregnancy, the endometrium convert into decidua. It is known as decidua during the pregnancy. The next one is uterine pacemaker situated at options: body of uterus, isthmus, cornua and uterus, and cervix. The right one is cornua of uterus. Cornua of uterus. Option C is the right one. So uterus, you can see that a dark color. So it means the pacemaker which produce the electrical impulses to construct the uterine wall to expel the baby. The next one is location of breast is formed. Options: 1 to 4th rib, 2 to 6th rib, 2 to 5th rib, and 3 to 6th rib. The right one is the 2 to 6th rib is the location of breast. The next one is hormone responsible for secondary sexual characteristics. Options: LH, estrogen, progesterone, and all of the above. The right one is all of the above. So these three hormones are responsible for having the secondary sexual characteristics in the woman or girl. The next one is LH surge occurs. Options: 24 hours before ovulation, during ovulation, 24 hours ovulation, fourth day after ovulation. The right one is during ovulation. So during ovulation, the luteinizing hormone is increasing. So it is called LH surge. The next one is the hormone which stimulate oocyte maturation. So which hormones is responsible to stimulate the oocyte? Options: GnRH and LH, FSH and LHRF. The right one is FSH. FSH is nothing but follicle stimulating hormone, is responsible for stimulate the oocyte. The next one is fertilized ovum is implanted in uterus after. So after the sperm is conjoined with the ovum, how many days it will take to implant the fertilized ovum in uterus? Options: 1 day, 10 days, 7 days, and 8 days. The right one is 7 days. So 7 days it will take to implant the fertilized ovum from fallopian tube to uterus. The next one is the corpus luteum of pregnancy is functionally active up to. Options: 10 to 12 weeks, 4 to 6 weeks, 2 to 4 weeks, and 6 to 8 weeks. The right one is 10 to 12 weeks. So the corpus luteum is functionally active up to 10 to 12 weeks of gestation. The next one is male internal genitalia develops from. Options: Mullerian duct, Ophidian duct, primordial duct, and basal duct. The right one is Ophidian duct. So Ophidian duct is responsible to form a male genitalia, and Mullerian duct is responsible for the formation of female genitalia, female reproductive organs. So the next last question is which hormone is responsible for fight and flight response? Options: thyroxine and melatonin, insulin and glucagon, epinephrine and norepinephrine, estrogen and progesterone. The right one is option C. Epinephrine and norepinephrine is also called as a fight or flight response. Thank you guys for watching my video. Please subscribe and share with your friends.